Ever wondered about the benefits of breastfeeding and if it's the right choice for you and your baby? Breastfeeding offers numerous advantages, not just for your little one, but for you too. Let's delve into the myriad benefits it holds. But before we begin, let me welcome you to Nenversa. On this channel, we talk about everything style, confidence, breastfeeding, pumping, and motherhood. If you find this video helpful in any way, please give it a thumbs up and consider subscribe to our channel so you don't miss any of our videos. To start, breastfeeding is the first and most natural form of nutrition for your baby. Mother's milk is a unique blend of nutrients and antibodies, tailor-made to support your baby's growth and immune system. It's the perfect food, always at the right temperature, ready whenever your baby is. But breastfeeding isn't just about feeding. It's also an intimate bonding experience between you and your baby. The skin-to-skin contact and the rhythm of feeding create a unique connection, a bond of love and trust that extends beyond the feeding time. Here's something else to consider. Breastfeeding is economical. There are no expenses for formula, bottles, or sterilizers. It's a natural, cost-effective method that not only nourishes your baby, but also saves your family budget. Let's not forget the benefits for you, the mom. Breastfeeding helps your body recover from childbirth more quickly. It aids in reducing postpartum bleeding, helps the uterus return to its pre-pregnancy size, and can even lower the risk of certain types of cancer. However, it's essential to remember that breastfeeding is a personal choice. Each mother and baby pair is unique. What works for one may not work for another. If you choose to breastfeed, that's wonderful. If you choose formula feeding, that's wonderful too. The most important thing is that your baby is fed, loved, and cared for. There's a lot to consider when deciding whether breastfeeding is right for you and your baby. It's a decision that requires thought, information, and sometimes a little bit of trial and error. But rest assured, whether you choose to breastfeed or not, you are a good mother. Remember, the best choice is the one that works for you and your baby. So, you've decided to breastfeed. But how does it work? Let's take a moment to appreciate the wonder of the human body. The process of breastfeeding is a miraculous combination of hormonal cues and physical mechanisms that have evolved over millions of years. It's a dance between mother and baby, and every pair has their unique rhythm. The story of breastfeeding begins in pregnancy. Your body, in its infinite wisdom, starts preparing to nourish a new life. The breasts increase in size and the milk-producing glands, known as alveoli, start to mature. After birth, when your baby starts suckling, it sends a signal to your brain to release a hormone called prolactin. This hormone stimulates the alveoli to produce milk. The milk doesn't just magically appear though, it's a carefully curated cocktail of nutrients, tailor-made for your baby. The first milk, called colostrum, is thick and golden. It's packed full of antibodies to protect your newborn against infections. After a few days, the milk transitions to mature milk, which is thinner but still brimming with all the nutrients your baby needs to grow and thrive. Now let's talk about the transfer of milk from mother to baby. It's all about the latch. When your baby latches onto your breast correctly, their mouth covers a good portion of the areola, and their tongue massages the milk out of the alveoli through the milk ducts and out of the nipple. There are many misconceptions about breastfeeding. Some believe it's supposed to hurt, but pain is usually a sign of an improper latch. Others think that breastfeeding will cause breasts to sag, but pregnancy itself is the real culprit. And let's dispel the myth that small breasts can't produce enough milk. The size of your breasts has nothing to do with your ability to produce milk. Understanding the process is the first step towards successful breastfeeding. It's a journey of learning and adapting, full of sweet moments and occasional hiccups. But with patience and perseverance, you'll find your rhythm in this beautiful dance of nourishment and bonding. Because remember, breastfeeding is not just about feeding. It's a warm embrace, a whisper of love from mother to child. Understanding the process is the first step towards successful breastfeeding. Preparation is key, and breastfeeding is no exception. Just as you would prepare a cozy crib for your baby, it's crucial to create a comfortable nursing spot for yourself too. This could be your favorite armchair, the corner of your couch, or even your bed. Make sure it is a place where you can relax, as you'll be spending a significant amount of time there. Next, let's talk about breast pads. Sometimes milk can leak from your breasts between feedings, and that's perfectly normal. To keep your clothes dry, consider investing in some breast pads. They come in disposable and reusable versions, so choose what works best for you. Equally important is a good nursing bra. These are designed to provide extra support and have flaps or panels that can be easily opened for feeding. You'll want something comfortable and functional. Remember, it's not about style here, it's about comfort and ease of use. A supportive pillow can also be a game changer. It can help position your baby at the right height for feeding, reducing strain on your back and shoulders. Pillows made specifically for breastfeeding provide the best support, but even a regular pillow can do the trick. But preparing for breastfeeding isn't just about getting the right gear, it's also about taking care of yourself. As a breastfeeding mom, you're your baby's primary source of nutrition. This means you need to be well-nourished and hydrated. Eat a balanced diet packed with protein, fruits, vegetables, and whole grains. Drink plenty of fluids, especially water, to keep your milk supply up. Lastly, remember that it's okay to ask for help. Reach out to a lactation consultant or your healthcare provider if you have any questions or concerns. No question is too small or silly. You're learning something new, and it's okay to seek guidance. With the right preparation, you're well on your way to a smooth breastfeeding journey. One of the most important aspects of breastfeeding is achieving a good latch. Let's dive into what exactly this means. When we talk about a good latch, we're referring to how your baby attaches to your breast during feeding. It's not just about the mouth on the nipple, but rather, your baby should take in a good portion of the areola, the darker area around the nipple too. So how can you tell if your baby is latched on correctly? There are several signs. First, your baby's lips should be flanged outwards like a fish. Their chin should be touching your breast, and you should see or hear them swallowing regularly. Importantly, a good latch shouldn't cause you pain. A little discomfort at the start is normal, but it should quickly subside. If it doesn't, it's a sign that your baby may not be latched properly. Now, if you're experiencing latching problems, don't worry. You're not alone, and there are solutions. Common issues include a shallow latch, where the baby doesn't take in enough of the breast, and a latch that's painful for you. So, how can you position your baby for the best latch? It starts with ensuring both you and your baby are comfortable. Try different breastfeeding positions until you find what works best for both of you. You might hold your baby across your lap or use a pillow to support them. Next, bring your baby to your breast, not the other way around. This helps prevent strain on your back and neck. Touch your baby's lower lip with your nipple to encourage them to open their mouth wide. Then, aim your nipple towards the roof of their mouth and swiftly bring them onto your breast. Lastly, be patient with yourself and your baby. It may take some time and practice to get it right. If you're still having trouble, don't hesitate to seek help from a lactation consultant or healthcare professional. Remember, a good latch is crucial for effective breastfeeding and your comfort. So take these tips, practice, and soon enough, you'll be a pro at achieving the perfect latch. Breastfeeding may come with its own set of challenges, but don't worry, you're not alone. First off, let's talk about sore nipples. This is a common issue, especially in the first few weeks of breastfeeding. The good news is, it's usually a sign that something needs a little adjustment. Often, it's about how your baby latches on. Trying different feeding positions can make a world of difference. And don't forget, after each feeding, express a few drops of your milk to rub on your nipples. Your own milk has healing properties that can help soothe and protect your skin. Next up, engorgement. This is when your breasts feel hard and uncomfortably full. It's most common in the first week after birth, but can happen at any time. To relieve this, try feeding your baby often and on demand. If your breasts are still uncomfortably full after a feed, express a little milk to ease the pressure. Cold compresses between feeds can also help reduce swelling. Lastly, let's address the concern of low milk supply. Many mothers worry they're not producing enough milk, but remember, your body is designed to meet your baby's needs. The more you nurse, the more milk you'll produce. However, if your baby isn't gaining weight as expected, or if you're still concerned, it's important to seek advice from a healthcare professional. They can provide strategies to increase your milk supply, or discuss other feeding options if necessary. Remember, every breastfeeding journey is unique and comes with its own challenges. It's normal to have ups and downs. Patience and persistence are key. And remember, there's a wealth of resources and support out there. from lactation consultants to online communities of other mothers on the same journey. Armed with these tips, you can tackle any breastfeeding challenge that comes your way. Sometimes, despite our best efforts, professional help may be needed. And there's absolutely nothing wrong with that. Breastfeeding, while natural, can present a unique set of challenges that may require the expertise of a lactation consultant or health professional. One of the key signs that you may need to seek help is consistent pain during feeding. While some discomfort is normal in the early days of breastfeeding, persistent pain is not. If you're experiencing ongoing pain or soreness that doesn't seem to improve, it could be a sign of improper latching or another issue that needs addressing. Another red flag is if your baby isn't gaining weight as expected. Now, all babies grow at their own pace, but if your pediatrician has concerns about your little one's weight gain, it's worth reaching out for help. A lactation consultant can provide strategies to ensure your baby is getting enough milk and help troubleshoot any issues you may be facing. Recurring infections such as mastitis or thrush are also a sign that you may need professional assistance. These infections can be quite uncomfortable and can interfere with successful breastfeeding. A healthcare provider can help diagnose and treat these conditions, making breastfeeding more comfortable for both you and your baby. But remember, seeking help is not a sign of failure. It's a step towards successful breastfeeding. It can be easy to feel like you're supposed to figure this all out on your own, but the reality is, many mothers benefit from some form of professional guidance. So, whether you're dealing with pain, concerned about your baby's weight, or battling recurring infections, don't hesitate to reach out. There are countless resources available, from lactation consultants to breastfeeding support groups, that can provide the help and reassurance you need. Never hesitate to seek help when needed. Your health and your baby's health are paramount. So take a deep breath, reach out, and remember, you're doing an amazing job. Breastfeeding is a journey, and like any journey, it's easier when you know what to expect. Today, we've navigated through the world of breastfeeding, and there are some vital points we'd like you to carry along. Firstly, the decision to breastfeed is a personal one, and it's all about what's right for you and your baby. Remember, every mother's journey is unique, and breastfeeding is no exception. Understanding the process is fundamental. Breastfeeding is a natural process, but it does not always come naturally. It's a skill both you and your baby will learn together. And like any new skill, it can take time and practice to get it right. Preparation is key. From creating a comfortable breastfeeding environment to learning different positions, every bit of preparation can make this journey smoother. Next, we delved into achieving the perfect latch, which is crucial for successful breastfeeding. A good latch means more comfort for you and more nutrition for your baby. Don't be discouraged if it takes a few tries to get it right. We also discussed common challenges and how to overcome them. From sore nipples to low milk supply, these hurdles may seem daunting, but with the right approach, they can be tackled effectively. Finally, we emphasized the importance of seeking help when needed. Whether it's from a healthcare provider, lactation consultant, or a supportive community, don't hesitate to reach out. Learning about breastfeeding is like learning a new language. It can be overwhelming at first, but with time, patience, and practice, it becomes second nature. This journey is a unique experience filled with moments of joy, surprise, and sometimes frustration. But remember, you're not alone in this. Thousands of mothers have embarked on this journey before you, and thousands will after you. With this knowledge, you're well prepared for your breastfeeding journey. Remember, every mother's experience is unique, and so will be yours.
Ever felt like you're losing yourself in the whirlwind of motherhood? You're not alone. It happens to the best of us. The transition into motherhood is a journey, one that often comes with an unexpected guest, identity confusion. Along with the joy and love that a new baby brings, there's also a sense of self that seems to get lost in the shuffle. The late-night feedings, the endless diaper changes, the constant worry. It's easy to forget who you were before you became a mom. And let's not forget